Sciences, Hyderabad. We have participants from Philippines. We have from Katak, from Hyderabad. I'm very happy to see you all here, and I really acknowledge you for taking out time and being here for this class. Okay, so the main intention of these classes are to make PSM or the subject of community medicine very simple or easy. Okay, we know the weightage of community medicine, and right now the problem of coronavirus and all, we have so much to cover in the coronavirus from the perspective of community medicine. We'll be doing that in future slides. So just today we'll have a demo or a very important full-fledged communication disease class wherein we'll be talking about the introduction to the ways or modes of transmission of diseases. Then we'll go a bit more detailed about the chickenpox and its epidemiology, and we cover the topic. At the end, we'll have some MCQs to just have an idea what kind of questions can be asked in the particular topic. And after this class, you will be shared with some questions from the very frequently asked MCQs from the previous FMGE or the next class, next exam, which is going to be started. Okay, so here we begin. At the end of this class, you will be able to define communicable diseases, enumerate modes of its transmission, describe the epidemiology of chickenpox. Okay, so the definition is just like any other communicable disease, it's an illness caused due to an agent capable of transmission either directly or indirectly to the host. Okay, the transmission mode depends mainly on the infectious agent which is the main person or the agent, and how it is entering the host and the local ecological conditions around. Okay, so with an example you can understand more better. Let us see in overview what all the different transmissions are and what rules are to be followed by that agent to actually cause the infection in the host. Rule number one disease, one route. So you have malaria, which is caused by Anopheles mosquito. So there's no other way malaria is being spread, okay, except for that agent malaria that the Anopheles mosquito is a carrier or the vector, which is infected by Plasmodium species, and this mosquito or vector carries it to the human host and cause a disease. So that is one disease, one route. And there are many other diseases which actually breaks this rule. So like HIV/AIDS, hepatitis B, okay, like HIV is transmitted by many routes. One would be sexual route, second would be blood transfusion, fluid exchanges, during inoculations, during procedures of injection. These many routes are being taken by this but one same agent. Let us see overview of all the modes of transmission. We said they are direct and indirect. Indirect, let us see what are those. Either by direct contact, the person is infected and you're another person which is not infected, they just come in direct contact and they get the disease. Droplet infection, the person coughs and the other person gets it, that's droplet infection. You know the coronavirus right now, it is spread by this mode of transmission, droplet infection. Contact with soil, yes, you have helmintic infections, we'll see that. Inoculation into skin or mucosa, some are very interesting, just enter by inoculating into the skin or the mucosa also. And finally, the transplacental transmission. Through the mother to the growing fetus, it crosses the placenta barrier and causes the infection in the fetus. Let's see the direct contact. Just by touching the other person, skin to skin and all, this can cause infection directly transmitted to the other person. Examples would be all the skin infections, the conjunctivitis eye infections, STDs, AIDS, and leprosy. This is how the droplet infection, the infective organism, spreads from one person to other as is released in the environment in the form of droplets. And if another person is present in front of him, and that person can catch the infection. Example are all the respiratory infections which we'll be dealing with in the first topic, and other elective fevers, same way, measles, mumps, and rubella. Contact with soil, yes, helmintic eggs which can enter just by, for example, people have a habit of mud eating, which is called pica, P-I-C-A, and those mud, if it has eggs of helminths, that can be transmitted into the GIT and cause infection, helminth infection. The other examples are tetanus and mycosis, the fungal spores. Another mode is by inoculation, by injection, or the blood route, or the parenteral, not other than the intestinal route. So that is by injections and transfusions. Example is hepatitis and HIV. And also rabies, which gets inoculated by the dog bite. Transplacental, very important MCQ question, let me tell you. Very few infections are transmitted by transplacental, and many are not transmitted. So that also you need to have a list of with you ready before your exam preparation. So the mainly are the torches. The code that is given, or the best mnemonic to remember is torches. T for toxoplasmosis, R for rubella, CMV, that is cytomegalovirus, herpes, hepatitis B, HIV, syphilis. And now varicella zoster, which we'll be speaking today in detail, that's the chickenpox. The other mode, we had direct transmission. Now we have, let's discuss about the indirect transmissions. Either by a vehicle borne, you have an infective case and non-infective or normal person, and you have a vehicle in between. That could be air, wind, etc. A vector is like an agent which can carry the causative agent. The airborne, fomite-borne. Fomites are non-living or inanimate objects which carry the infective organism without giving it anything other than place to stay. Now, as you know, fomites right now are a very important source of infection in case of coronavirus. So, that unclean hands and fingers, same thing for coronavirus. So, indirect transmission can be seen in this diagram. Okay, there's a person on totally on the left side who is passing the infective organism by through his feces into the environment, and that is being carried away either by the flies, the first one, either by the floor or by the fluids, by the fingers. So 5F, you can remember how the indirect transmission happens. That is by food, by fluid, by flies, by fingers, and by fomites. Okay, so we had one mnemonic there for transplacental transmission, that is torches, and here we have for indirect transmission 5F. The whole summary of what we have discussed. Let us go in detail about the respiratory infections. Ready? Okay. The chickenpox. So before we go in detail about chickenpox, let us see what. Let me tell you a story about chickenpox. Okay. So imagine there's a like 6-year-old girl by name Zania, and she has developed some rash over her body, on the chest, and her mother is worried. What is this new thing that she has? And she's also has some temperature, and she's saying, "I'm mommy, I'm so weak." So the mother, concerned about her health, takes her to a pediatrician. The pediatrician, he just examines and says, okay, so Zania is actually suffering from a viral infection called chickenpox, which is very common in the age of 0 to 10 years in children. And that is being, you need to be careful about it because it spreads in almost 90% times to the people around Zania. So that would make you to take some precautions and also take care of the child. Okay. I request Ravi sir to just go on mute, please. Ravi sir. Okay, there's some disturbance from that end. I'm sorry for that. So now Zania has got this chicken pox, and the lesions are all over her chest and some over the trunks. Okay, some over the trunks. So it's just like something like a symmetrical and centripetal, that is towards the center of the body, more the uh, rashes are present. And those rashes were typically in all stages, like it was all like flat, raised, with the pus, or in the scabbing stage. So it's all like pleomorphic, the multiple forms of rash seen at one time of examination, and that is very classic of identifying it to be a chickenpox infection. So the pediatrician goes on and says to the mother, okay, no need to worry. It's very common. It's very common that children will have this infection and most probably will have immunity for lifelong. They will not have the same chickenpox in their life again. But if there is some immunosuppression in any time of phase in adult life, people may get a rebound of infection in form of herpes zoster. Okay. So, and with that and some advice of medicine to just apply it over the skin to avoid itchiness, antihistaminics and antipyretic for fever and itching, the doctor sends the mother home. The mother is very concerned, and the girl has a brother who is a medico. The medico. So he wants to, his name is Sohail. So Sohail wants to know more about chickenpox. So what he does, being of medical background, he just takes out his Park textbook and sees, okay, let us learn about this more. How I can make my sister have a better care during this time, and how I can prevent this particular thing from spreading in the family. So he sees, okay, so this is a very the burden over worldwide is not much, and the fatality of or the death rates because of chickenpox is very very low. That is almost like 4 per lakh of population. Okay, and in India it's like 0.2 fatality rate in India. So he thinks, okay, so which state in India is having more problem? So he finds out the most literate state, that is Kerala, is reporting the highest number of cases, and the most number of deaths are happening in the Roshagulla state, that is West Bengal. Okay, the two states here which he found, Sohail found, are having more problem in India. And then he goes on reading and finds out the agent's name is varicella zoster, and this virus is very, very heat labile. So it just cannot tolerate heat, and it needs environment of chilled weather or the winters or the rainy season to survive. So that is the most common season when it spreads. He also finds out after the infection, this virus goes and sits down in the nervous system, in the ganglion of the nerves, cranial nerves, in the dorsal root of the spinal cord, and many other nerves as a latent or sleepy phase. And it may get reactivated in 10 to 30% of people and cause something called herpes zoster disease and not chickenpox. We're not calling the secondary infection of this as chickenpox. We call it a separate name, herpes zoster, and that is having a classical separate feature of having rash over one single nerve dermatome, or the one nerve which is supplying to the particular area. Only those that area has the rash and not the whole body, like chickenpox. So he starts to learn more about it. He finds out, okay, so let us let me see what all I can learn about chickenpox. He also sees that there are like preventive measures. There are some vaccines and there's some immunoglobulins for it. So immunoglobulins we don't give for the people who are affected with chickenpox because it's of no use. Only for those who are in contact with the person who are very weak, who have immunosuppressed, immunocompromised, who are on medicines which require very lowering of immunity, like HIV or cancers. In such conditions, those people may need immunoglobulins. And there's also vaccine, that is a live attenuated vaccine or a live weakened vaccine, which is to be given in the age group of 1 to 1.5 year of age if the child has not got chickenpox. So babies who are 1 to 1.5 year, give one dose of chickenpox vaccine that which is live attenuated, and that will prevent for almost 10 years for the child from contracting the disease. Okay, so it's very powerful vaccine. So let us see the whole story you have heard. There's some numbers you have heard. So we'll just go through the topic as such now, and just you try to reconnect with the story of Sohail and Zania and what chickenpox is all about. Like point two is the case fatality rate. The always when you talk about community medicine, any infection, just we need to remember the epidemiological triad. That is, the agent, host, and the environment needs to interact with each other. Only then the disease happens. The agent is what varicella zoster, also named as human herpes 3, number 3. We also will be discussing about human herpes 1, 2, 3, and in the later classes. Host factors, like we know, in children up to the age of 10 years and in immunosuppressed. And the environment in the winters, and it spreads in the people where there is overcrowding. Let's see about the agent now. There's a photograph or the DP of the varicella zoster virus, the double DNA. Okay, the most important source is a case of chickenpox. The infectivity, yes, doctor should have mentioned to the patient that the patient's mother that before 2 days of the rash appearance and 6 days after the rash appearance, this virus can spread to other people. This is the period of infectivity. 2 days before rash to 6 days after the rash appearance. Important thing to note is in the rash, the last phase or the crusting or the scabbing stage, it's not infected. Secondary attack rate, like it's nothing but how many others can get from the primary case. It's 90%, very, very high. Let me tell you, most of the respiratory infections have very high secondary attack rate. Incubation period, like most of the respiratory infections for coronavirus also is 14 days. I have just marked like Q there so that you can note down, and it's a very, very frequent asked question in FMGE and the next. Let us see how this appears. First photo is showing of a child who is having different sized lesions over his body first, then it spreads to the face and the trunks. Also, the mucosa is also involved. The reactivation in the adults, you can see adult body there, backside of it shown, wherein one dermatome or the nerve which is supplying to that area, which has the virus in the latent phase, reactivated and caused a rash, which is known as herpes zoster. It's a very painful vesicular rash in the adults, and the adults show very severe form of chickenpox if they don't get in the childhood. Yeah, 10-year-old immunity is lifelong after first infection. In the pregnancy, let's see about the pregnancy before 20 weeks. If that is during the development of the organogenesis of the fetus, if the virus is present in the body of the mother or the mother is infected because of varicella zoster, then the chances are high that the fetus will have it, and the organ development will be getting affected. So that everything is small sized. That's called congenital varicella syndrome, which happens in 2% of the fetus of the mothers who are infected, but the 2% also high. Okay, if the mother develops chickenpox within 5 days of delivery, the newborn is at risk. have a very disseminated disease or very with a complicated picture. So they will be need of giving immunoglobulins immediately to the child when we know there's a history of chickenpox in the mother, which after the 5 days of delivery. Here I have bolded the numbers like within 5 days of delivery, and also like before 20 weeks of gestation is to be remembered. How the child looks is very small, like it's called to remember. You can remember as all small. Like we have the microcephaly, small head, small eyes, and small ears. Limb deformities. You can see a child with a limb deformity in the left leg is shrunken and very thin here. Also, there will be therefore low birth weight. This is a characteristic feature of congenital varicella syndrome. Also, important question as a complication of chickenpox. How does it transmit? It's very unique actually. It's actually a respiratory infection and causing rashes over the body. You have one respiratory route, that's indirect transmission through airborne or the droplets, okay, and the other one is through from mother to the child to the placenta, and the important, which is very common, is by the lesion, by the rashes, by the pustules, these or the vesicles which erupt, and there's a skin contact with that, and the person gets it and gets into the other body. That's direct and indirect, both are there. It doesn't follow the rule of one infection, one route. No, it has multiple transmission routes. Clinical features, very important slide. I want your concentration here, please. So you have the first stage, the pre-eruptive, 2 to 3 days before the rash and fever and malaise there. Then there is eruptive, that is nothing but the eruption of the rashes from which are symmetrical, centripetal, more on the trunk. Dew drop, this was a very keyword, dew drop. You can see on the leaves, they have a drops when there's rains on the mornings. The dew drop, that's kind of rash. They are also pleomorphic, all stages at one. Flat macule, papule, vesicle, and scap. All can be seen at one stage, and it's more on the flexile aspect, on the flexile. Okay. There is fever with each fresh crop of rash. This is actually differentiating this chickenpox from smallpox, where there's no fever. There was no fever with the rash. Okay, here chickenpox will have fever mostly with the onset of rash. This to show all the stages in one area can be seen: macule, papule, vesicle, and the crust. Let me also point you again. This crust will not be a transmission phase. Still vesicle is transmissible. Let's compare again. It's very important. Smallpox eradicated, yes, but it has to be differentiated. So we have centripetal in the chickenpox on the right side, the more in the center, whereas in smallpox it was more at the periphery. Very dangerous picture on the face, especially. It was there. That's the complications. One we have talked about is congenital varicella syndrome. The other one would be Ray's syndrome. Okay, so it's very important for any respiratory infection, pneumonias, to avoid aspirin or salicylates. That will increase the risk of Ray's syndrome, which is nothing but acute encephalopathy and the fatty liver, the abdomen. Okay, we'll have more about syndromes in future classes. So another complication such as the respiratory infection, the pneumonia, one complication, very rare, the acute retinal necrosis, especially in patients immunocompromised like AIDS patients. Secondary bacterial infection. So what happens is the lesions on the skin already has multiple staphylococcus and streptococcal bacilli, bacteria, and the child scratches because of the pain and itch, and from the other side of this normal side of the skin, it gets inoculated in the skin and causes bacterial infection. So thereby, we may need antibiotics also in patients with chickenpox. Lab diagnosis, yes, we have. Let me make it very simple. Any lab diagnosis of any agent, either just view that or isolate that agent, or its components like the coat of the virus or bacteria or fungus, or check its antibodies. So you have the agent, you have its components like called antigens, or you can just check out the antibodies. So for this, the first test is agent detection. It is very sensitive. Yes, agents, when you actually see the agent in the microscope or in the cultures, you are actually confirming the presence of it. It's more sensitive than the antibodies detection. Okay, for any infective test, agent detection is more sensitive. Virus isolation can be done in cell cultures, and viral DNA can be identified by PCR. Right now, viral DNA is being identified of the coronavirus by PCR, RT-PCR, real-time PCR. That's a question for you. The antibodies, we know IgM is the first one to come. So if you find out IgM is present of chicken varicella, yes, it's confirmed that it's an acute infection of varicella right now. IgG is a later component after 4 to 5 days. This comes in picture, that is antibody immunoglobulin G. We'll talk more in detail about antigens and antibodies in the further chapters in a very detailed way. Come to the last part, the prevention and control. The primary, secondary, tertiary. I have taken a class before this wherein I told only about prevention. Any prevention in community medicine or any disease talk about in three terms: primary, secondary, and tertiary. In primary, you have two things. What is that? Health promotion, specific protection. Okay, so health promotion is in case of chickenpox, we need to isolate the child or the person who's infected for at least 6 days after the onset of the rash. Okay, that is an infective period. We know that, right? And then the specific protection, yes, for some it's there, for some it's not there. Right now, we don't have a specific protection for coronavirus. For chickenpox, we have it. It's an immunoglobulin in immunosuppressive advice, not for all. And vaccine, yes, it has been given by Indian Academy of Pediatricians. It's in the schedule. You need to remember that also. Okay, it's given. Route is subcutaneous. The second preventive level is a secondary prevention, that is the patient already has it and is undergoing diagnosis and treatment. The treatment, if required in complicated cases, only in complicated cases, is acyclovir on the antiviral drugs. We do not administer for every chickenpox case treatment for it with antivirals. Tertiary, it's not a disability causing disease in the children or the adults, so it's not applicable here. To summarize, we have seen a definition of communicable disease as an agent causing a disease and it spreads to other people and through that. We have seen the modes of transmission as direct and indirect. We have multiple indirect and the multiple in the indirect also. We have seen the details of chickenpox, especially the rash feature, which is very important and interesting. Okay, everyone, that is a summary of what we have just dealt with. I just want you to relax and just see the questions and reply in the chat with what you have, the answer. Let's see who answers first. Ready? Okay, here we go. First question. I'll give just 10 seconds for each question. Okay. Infectivity of chickenpox lasts for A, till the last scab falls off. B, 3 days after onset of rash. C, 6 days after onset of rash. And D, till fever subsides. Any answers? Let me check the chat. Just mention A, B, C, or D. No one? Okay. Let me give you the answer. That is nothing but 6 days after onset of rash. Okay. Next. Okay, I got an answer. Let's see, who was that one? Very good. Yeah, Dr. Pushpa. Very good. You got the right one. Next question. Everyone be ready. All are true about varicella virus except that's very important, tricky. Okay, 10 to 30% recurrence. All stages of rashes are seen at the same time. Secondary attack rate is 90%. Rash commonly seen in extensor area. I got an answer. Let's see. Okay, Pushpa, you're saying a C. Secondary attack is 90%. Okay, now it's actually correct thing that secondary attack rate is 90. We're looking for the wrong answer in this option. So it's all the first three are correct. That is 10 to 30% are recurrent in adulthood. As herpes zoster, all rashes, that's all stages of rashes. That's why we call it as pleomorphic rash. Secondary attack rate is 10. So it's actually seen in the flexor aspect on forearms. Okay, and not this side, not on the other side of the arm. Okay. So the answer is D. Rash commonly seen in extensor area. Two more questions. Okay, let's see who answers first. All are true about chickenpox except centripetal distribution, pleomorphic rash, rapid progression from macule to vesicle, crust contains live virus transmitted by eating chicken. There can be multiple answers also, let me tell you. Anyone? Tick tick 1, tick tick 2, tick tick 3, tick tick 4, tick tick 5. Okay, let me give you the answer then. The answer is now it is centripetal. Okay, I got an answer. See, okay. Pushpa says E. Yes, it is not transmitted by eating chicken. Very good. There's one more wrong answer in the slide. Who can point out that? Okay, let me give you the answer then. The crust at the last stage I said is not transmissible. So D, very good, Tarun. Congratulations, very good. It is D, that is crust contains live virus. Now they die by the state of vesicle formation. So crust state is therefore not transmissible. It's not spreading during that stage. Okay. So two answers in the slide, and that is crust contain live virus is wrong. It's not transmitted by eating chicken. I don't know why they put chickenpox, right? Okay, that's it. Remember this, speaking 1 meter to 2 meters away from the person who's infected, which is right now the advice for the coronavirus prevention. That's advice given for every infection which is spread by droplet infection. Okay, so covering your face with a mask, washing frequently, hand washing, which might contain the virus from the other people or the fomites when you touch it, and speaking from a distance is the best thing to do right now. So really, I wish you all be safe during this time, very difficult time, extraordinary time right now, wherein we have the coronavirus pandemic which is going on. We'll learn more about epidemic, pandemic, and other types of disease spread in later classes. Thank you very much. Any doubts? Yes, we will be